Put simply, respiratory physiotherapy is physiotherapy for the breathing system. Breathing is something that we all take for granted. However, many people experience unpleasant and frightening symptoms in relation to their breathing. As respiratory physiotherapists, it's our job to help these patients by removing their troublesome symptoms and helping them to get back to doing the things that they want to do. As respiratory physios, we also have a thorough understanding of the way that the heart and lungs work together so that we can provide safe and effective treatment for these patients. We see patients with underlying lung conditions to help reduce their symptoms of breathlessness and to help them be as active as possible. And conditions might include COPD, bronchiectasis, asthma, or IPF. We also see patients with perfectly healthy lungs, yet they still experience symptoms of breathlessness. And these patients may have something called a breathing pattern disorder, which is when the mechanics or the way that somebody breathes becomes disrupted. And this can lead to frightening and quite disabling symptoms in some cases. And respiratory physio in this sense will essentially reteach somebody how to breathe optimally. We also see patients with long COVID, and for these patients we will help them to regain control of their breathing, and we will also help gradually increase their physical activity in a safe and controlled manner. For these patients, it's really important that they have an individualised approach with close monitoring, because it's really easy for these patients to overdo it. The aim of respiratory physiotherapy treatment is to help and encourage patients to lead an active and independent lifestyle that is free of troublesome symptoms. Now, treatment can take several different paths depending on the patient's underlying complaint or their underlying lung condition. As an example, treatment might include reteaching somebody how to breathe optimally so that they can take adequate and satisfying breaths rather than breathing with the top part of their chest. And this top-heavy way of breathing can sometimes occur in situations when we get stressed or anxious, but it can also occur after a period of illness. We can also help patients to become more confident when exercising, so we can prescribe appropriate physical and breathing exercises for these patients so that they're exercising safely. And we can also prescribe breathing exercises to patients to help clear their lungs of secretions. So we call this airway clearance techniques. And this is particularly beneficial for those patients who experience recurrent chest infections. So at Air Physiotherapy, we provide face-to-face consultations in clinic-based settings, and we can also offer virtual consultations so that even if you don't live close to one of our clinics, you can access our services and our specialism wherever you are in the world. So if you've watched this video and you think that respiratory physiotherapy might be for you and might be able to help your symptoms, then do get in touch.